If you've ever checked your blood pressure at home, there's a good chance you may not be getting a completely accurate reading. In fact, small mistakes in how you measure your blood pressure can change the numbers more than people realize. In this video, we'll go over the correct way to check your blood pressure, along with some of the most common mistakes that can throw your reading off. Welcome to your health numbers. Before we go step by step, it helps to understand why technique matters so much. Blood pressure can change based on your posture, movement, stress level, and even how you're sitting. So if your technique isn't consistent, your readings may not reflect your true blood pressure. Let's start with position. Sit in a chair with your back supported and both feet flat on the floor. Try not to cross your legs. Your arms should be supported and resting at about heart level. Next, make sure you rest before taking a reading. Sit quietly for at least 5 minutes first. Avoid talking, moving around, or checking your phone while you wait. A lot of people also don't realize that certain things can temporarily raise blood pressure. So before measuring, try to avoid caffeine, smoking, or exercise for at least 30 minutes. Cuff placement also matters. If you're using an upper arm monitor, place the cuff on your bare upper arm, not over clothing. Make sure it's snug, but not too tight, and keep the arm supported at heart level. It's also a good idea not to rely on just one number. Take 2 readings about 1 minute apart, then look at the average. That usually gives you a more reliable picture than a single reading on its own. Some of the most common mistakes people make include talking while measuring, sitting with crossed legs, leaving the arm unsupported, checking too soon after activity, or using the wrong cuff size. All of these can affect the accuracy of the result. As a pharmacist, one thing I often see is people using wrist blood pressure monitors because they're more convenient. While they can be useful, they're more prone to inaccurate readings if they're not used properly. To get an accurate result with a wrist monitor, your wrist needs to be positioned at heart level, which often means bringing your arm across your chest toward the opposite shoulder. If the wrist is too low or too high, the reading can be misleading. That's why, for most people, upper arm monitors tend to be more reliable. So, how do you take your blood pressure correctly? Sit comfortably, rest beforehand, avoid caffeine or activity right before checking, position the cuff properly, and take more than one reading. Small changes in technique can make a big difference in how accurate your numbers are. If you found this helpful, consider subscribing to your health numbers for more simple breakdowns of the health numbers that matter most.